Welcome to Grand Rounds in Urology, the UroEdge Learning Centers. I'm Diane Newman. I'm a urology nurse practitioner and the Senior Editorial Director of Grand Rounds in Urology. I'm creating an advanced practice provider learning center to educate our nurse practitioners and PAs and other nurses in urology all about urologic diseases and a lot of different conditions. But I'm also looking to start a catheter center, and I'm really excited today because I have a expert and a colleague of mine, Gina Powley. She's a master's prepared urology nurse expert who's been practicing for many years. And I asked her to talk about the changes that are going to occur with Medicare's coverage of ostomy and catheter devices. So welcome, Gina.
Thanks, Diane. I appreciate you having me on today. So, again, thank you so much for having me. It's my pleasure to discuss the CMS HCPCS code changes for intermittent catheterization. I have been a urology nurse for 32 years. I'm a urology nurse practitioner certified for almost 20 years. And we've been using the same codes for intermittent catheters the entire time I've been practicing. Many colleagues may not know what HCPCS codes are, may be familiar but not really completely understand them. But I was always very interested in billing. Maybe I was a little geeky when it comes to that. So I knew what codes to use, how to document to get the catheter I ordered covered by insurance. So it's really fitting that I've been part of the code change as a Hollister employee, but also as a student president when discussions with CMS were being had. So I wanted y'all to know that yes, I am clinical resource manager for Hollister Incorporated, and I have been in this role for the last 4 years. So let's first start at the beginning. Intermittent catheterization has been around since ancient times, starting as early as 3000 BC when Egyptians used flexible gold tubes. Over time, people used hollow reeds and metals to help drain your urine. I mean, obviously, if you ever had urinary retention, you want to do whatever you can to get that urine out of your bladder. After World War II, Dr. Ludwig Gutmann introduced sterile intermittent catheterization for spinal cord injury patients. In 1971, Dr. Jack Lapides really revolutionized the practice with clean intermittent catheterization, or CIC, which is more commonly known as. He believed that infections were more likely caused by urine retention and overstretched bladders, not just bacteria. CIC uses a clean, not sterile technique, making it so much easier and safer for patients to do themselves. It helps protect bladder and kidney health. It improves independence and quality of life for people with bladder issues. The first hydrophilic catheters were invented in 1983 by Wellspect, and they were called Lofric. Coloplast introduced their first hydrophilic catheter, SpeedyCath, in 2013, and December of 2014, Hollister launched Vapro Plus touch-free hydrophilic intermittent catheter. So HCPCS stands for Healthcare Common Procedure Coding System. It's a coding system used to describe and report medical procedures, supplies, and services provided by healthcare professionals. It's particularly used for billing purposes with Medicare and Medicaid, but really all private insurances adopt the same PIC codes as Medicare. HCPCS codes have been around since 1978. Currently, there are 1,300 IC products constrained into just 3 HCPCS codes, and these categories really are very basic. This has prevented researchers to fully understand what IC product the end user is utilizing if it's not documented in the chart notes. Clinicians cannot track to see if the end user has been switched to a different, less quality of a product by the DME, and they can't track results of utilizing a hydrophilic catheter over a gel catheter because they don't know if the patient is still using the same product originally ordered. So since 2010, CMS has received 6 applications to expand HCPCS codes for intermittent catheterization. In July of 2022, AA Home Care led a multi-stakeholder coalition and applied for new HCPCS codes to recognize various catheter technologies. This coalition comprised of manufacturers, physicians, and nursing organizations and trade associations. I was in some of these calls with CMS representing Hollister and SUNA when I was president in 2023. The coalition originally submitted to expand HCPCS codes for IC from 3 to 19 codes. CMS had their own research done, and their decision was published in the first biannual 2024 HCPCS coding cycle that they would establish 3 new codes for intermittent catheters, bringing the total IC HCPCS codes to 6. The effective date of the changes is January 1, 2026. So here are the new codes. As you can see, the old codes are still viable codes. However, they are for pre-lubricated or uncoated catheters. The new codes are specifically for hydrophilic-coated catheters. So A4351 is straight tip with or without coating. When you talk about the coating, that's meaning gel. A4295 is straight tip with hydrophilic coating. A4352, coude tip with or without coating. A4296 is coude with hydrophilic coating. A4353, closed system catheter with insertion supplies. And A4297, closed system catheter with hydrophilic coating with insertion supplies. So hydrophilic catheters have a special polymer coating that becomes very slippery when activated with water or sterile saline solution. There is growing clinical evidence that shows these catheters are designed to reduce friction during insertion and withdrawal, minimizing urethral trauma and potentially lowering the risk of urinary tract infections and stricture disease. Hydrophilic catheters can be either activated by the user by breaking a sachet of sterile water or saline within the packaging, or come pre-activated with the coating already hydrated. So Hollister has a complete portfolio of hydrophilic catheters that are ready to use out of the package. Here you can see our only Infina Chic and Vapro with 100% no-touch protection. The benefits of the new codes are to protect clinician and patient product choice, recognize product innovation, and improve tracking of patient outcomes and improve tracking of hydrophilic use. This is really so important for research, and it will help make finding this information easier for researchers. You may be wondering if these code changes will cause more work for you and your office staff. CMS has clarified that some patients will need new prescriptions, or you may know of them as standard work orders or CMNs, for hydrophilic catheters effective January 1, 2026. A new order will be required if the current prescription lists the old billing code A4351, A4352, or A4353. The new order can instead use one of the new codes, A4295, A4296, or A4297, a general hydrophilic catheter statement, or a specific brand or model number. If the current order already says hydrophilic catheter without the old codes, then no new order is needed. CMS has also indicated that no pricing changes or new qualifiers for hydrophilic catheters are expected currently. And this is so important to remember because we do not have to do anything extra in our charting to get our patients qualified for these products. You may start hearing information from the DME that you use in your office regarding new order forms to help make the changes smooth for you and for your patients. They may start doing this now because we want to make sure that once January 1, 2026 comes, there will not be any hiccups for your patient's orders. And here are the references that I used for this presentation today. And I want to thank you again so much for having me. And here is my contact information if you have any questions or want to talk to me further about this.
Thank you so much, Gina. This was so informative. So this is going to change in January, right? So I think that, it's really important that we share this information with the audience on Grand Rounds in Urology. So they're differentiating now the hydrophilic coating versus non-hydrophilic. Is that really the crux of this, correct?
That is really the crux of this. So currently, if your patient is on a hydrophilic catheter, now with the new codes, the one thing that as a practitioner, I was always worried about is that the DME may switch the patient out to maybe a cheaper, less of a product that I wanted for them. Now, if I prescribe a hydrophilic catheter and they want to switch it out, they actually need to get a new order for me. So then I hopefully, understand the differences and I can say why. I know insurance will cover this and I would charted it properly. So now we as the clinicians can really help monitor to make sure our patients get the right catheter that we prescribe because we're the ones that know our patients.
No, and you're right. I think what's important for clinicians is they need to instruct the patient specifically on what that catheter is. You and I have been talking about that for our whole careers, right?
Yeah.
Instructions, making sure the patient knows specifically what we are prescribing for them based on our assessment and what's working for that patient so that they do catheterize as we prescribe. So I think that it's going to be very important for clinicians to really let them know that, talk a little bit about what that catheter material is about, right? And the fact of the coating.
Exactly. And we have found by so much research, and I know, Diane, a lot of research that you have been a part of, that hydrophilic-coated catheters really do help protect our patient from adverse outcomes. And, they're performing intermittent catheterization 4 to 6 times a day for potentially the rest of their lives. So we want to keep that urethra healthy.
No, you're right. And the thing is, you mentioned some of your products, which I think are really wonderful. There's going to be no difference, though, between male and female products, correct? There's no difference in coding, right?
No.
And then also, you have a fantastic catheter with the sheath with the VaPro that, patients really love because it's really a no touch. They didn't really want to give us a code for a no touch kind of concept, did they?
No, they didn't. Like I said, we originally wanted 19 codes and it really did differentiate all the different technologies. But when CMS did their research or had their company or whoever they really utilized, they did not feel that 19 codes were necessary, even though for us as clinicians who know all the different nuances, we wanted it, but at least we were able to get 6 codes now, at least get those hydrophilics separated for once.
No, and I think what you're bringing up is Hollister, as well as other companies, are really improving on technology for catheters we use intermittently because patients are living longer, right? And we want to really have catheters that minimize the complications that we see long term. And it's a little kind of disturbing that CMS hasn't kept up with that because you're right, the technology and the differences now in catheters is really increasing, and that's why you guys put in the 19 codes. But let me ask you something else too, though, is that education is going to be important, but do you think that reimbursement they're going to differentiate between the hydrophilic and the non-hydrophilic?
Right now, they say no.
Oh, really?
At least for starting January 1, 2026. I know manufacturers can work with private insurance companies to try to maybe get a better contract, but CMS for Medicare isn't making any changes currently. Does that mean they're not going to change things in the future? Who knows? The same way with documentation. Currently, we don't need any more documentation to get the hydrophilic catheter. Will that change in the future? Only time will tell.
But you mentioned, I think it's really important, you just bring it up again, the documentation. When we prescribe, we really need in our notes state why we want a hydrophilic coating, if we want a non-touch too. I mean, I think that's so very important also, and why. And I think that that's, that's really the crux of how we can support possibly the use of these codes with individual patients. Because they didn't, are they changing anything about the how many UTIs you had to have before you could do something different?
No, they're still
No.
keeping it 2 UTIs in a 12-month period, documented in chart with specific symptoms.
Right.
So
Okay.
that's still
then present. Well,
for the closed system catheter.
sure.
Yeah.
This was really, really helpful. I know our viewers are, and we have a lot of urologists, and I think they should be aware of this also too, residents as well as
Absolutely.
nurses and nurse practitioners and PAs, because we treat these patients every day in our practice, right? And we
Oh,
really
yes.
need to be informed, because this is a big change that's occurring. And what,
A
it's been
huge
what,
change.
30 years before, right? We
Right.
said in the 70s we started these HCPCS codes. We haven't had changes in the area of urologic supplies and catheters for a long time.
Yeah, it's definitely time for a change.
Right. Well, thanks so much. Really appreciate you giving us this information, presenting
Thank
it
you,
to us.
Diane. I appreciate you having me today.